Hi, this is Dr. Mary Pentel. Welcome to my channel, Dr. P Cosmetics Made Simple. So tonight I'm going to play for you a presentation that we did on our virtual event on March 25th. The virtual event was called Melt, Tighten, and Tone. And what I did was I talked about different devices that help melt your fat, also tighten your skin, and tone your muscle. Because sometimes just fat melting by itself may not get you the results that you need. Sometimes there's a combination of melting fat, tightening skin, or melting fat and toning muscle. So I believe that when you do combination treatments, you actually get more, you maximize your results more. So I hope you enjoyed the following presentation on Melt, Tighten, and Tone. All right, so tonight we're going to be talking about fat reduction, skin tightening, and muscle toning. As you can see, we all look in the mirrors and we usually do not like what we see. Look at Barbie. She doesn't really like what she sees because she's aging, she's starting to be a little bit menopausal, she's starting worrying about her fat bulges, her tummy pooch, her love handles, and her inner thighs, and her flabby arms. So what can we do when we don't like what we see? Like I said, the bra fat, the submental, these are things that patients come in to ask us about. How can they get rid of this fat and tighten their skin? The arms, the flabby arms, the bra fat, the inner thighs, and the tummy pooch. So we're going to talk about non-invasive fat reduction. I always tell my patients there are 4 things we can do with fat that's non-invasive. We can freeze the fat, so we can use cold. We can melt the fat by using radio frequency and intense focus ultrasound. We can shake up the fat using UltraShape and Ultimate Contour, or we can inject the fat with a chemical like Kybella. Most of these are permanent fat reductions, especially the Coolsculpting and TrueSculpt ID and the Kybella. Now, tonight, we're going to concentrate more on the Coolsculpting and TrueSculpt ID. So before we talk about any fat reduction, I want to talk about what constitutes fat. What do we see that that the devices can touch? Because remember, not all fat can respond to the devices. So let's take a look at the video.
Hi, this is Dr. Mary Pentel. Have you ever wondered why some of these fat reduction devices and treatments don't work? Well, first you have to find out what type of fat do you have. What do I mean? Do you have visceral fat like this, where it's very, very nice and firm? And this visceral fat is more around your organs, underneath your muscle, okay? So this type of fat you have to get rid of with good diet and good exercise, because this fat cannot go into any devices, so it doesn't work as well. Versus the more soft fat, we call it pinchable fat. This is subcutaneous fat. When I pinch this, I can then put these fat in Coolsculpting, TrueSculpt ID for the skin tightening. So there's a lot of other body contouring things. So if you have more pinchable fat, you will get better results. Now sometimes we look at that, okay, so we melt the fat, but what happens to the loose skin? And some people don't think about that. So sometimes you have to melt the fat and you have to tighten the skin, okay? And you can do that with a radio frequency device too, the TrueSculpt and some of the other radio frequency devices. And we have this procedure we call melt, tighten, and tone. Melt the fat with Coolsculpting or TrueSculpt ID. Then we also tighten the skin with the radio frequency of TrueSculpt. Then we use Sculpt to help with the muscle, so meaning to tone up your muscle. It also melts fat and also tone up muscle. So I figure by doing it in combination devices, we can get you the best maximum results possible to melt your fat, tighten your skin, and tone your stomach. So call us at Southside Dermatology and Laser Cosmetic Center and find out which type of fat you have and what we have to treat it.
So that was the video for to show you which type of fat will respond to certain treatments. So right now, like I said, we have the subcutaneous fat that we can treat with TrueSculpt ID and Coolsculpting. But what else can get the visceral fat besides diet and exercise? Well, we have 2 devices here, TrueSculpt Flex and Sculpt, that is more of a muscle toning, but it also does decrease the visceral fat, possibly around 19%. With a session of treatment. So using a combination of this treatment, you can actually then decrease your fat more by decreasing the subcutaneous fat and the visceral fat. So Coolsculpting, as we know, has been around for a long, long time. We use that for multiple areas. It has many applicators that will fit underneath your chin, your arms, your inner thighs, your abdomen. So this does work. Let's see how it works. Oh, I'm sorry, hang on. Let's see how this works.
The applicator delivers vacuum pressure and cooling to the targeted site. As the applicator pulls the bulge into the cooling panels, you will feel a firm tug and pinching and intense cold. There may initially be some tingling, but this typically subsides as the area gets numb. The fat cells are targeted and cooled, triggering their natural death. And because fat is more sensitive to cold, surrounding tissue and muscles are not affected. Over the course of the next few weeks, your body begins to naturally eliminate the dead fat cells. As the fat cells are eliminated, the remaining cells condense, resulting in an overall reduction of the fat layer. In the weeks and months that follow, you will see an undeniable reduction of fat. And as long as you maintain your healthy lifestyle, the treated fat cells won't come back.
So that is how Coolsculpting works. So let's see the actual Coolsculpting treatment. Oh, I apologize, I don't know. Here we go. Okay. So she is putting on the applicator, getting ready to put on the applicator. She's prepping the skin. And now these are the different types of applicators that you can put on. You can have the larger one, which is more of the Cool Advantage Max. Then we have smaller ones that you can also put on. So when you come for a consult, they're gonna measure you and just to see which applicator will give the best results.
I feel like really cold and tingly a little bit for the first few minutes, but then it wears off. You got two going on, huh? Yeah.
So now she's gonna take that off and you have this sort of really cold, indurated area. And by massaging it, it really helps kind of decrease the fat and makes it, I guess, take better. So this area is a little, when you do this massage, because I had this done too, it's a little bit sensitive. So, but it only lasts usually if you do a 2-minute massage to this area. So Coolsculpting does cause permanent fat reduction without any damage to skin, muscle, and nerves. You have an average around 25% of fat reduction per treatment session. Now with anything, we really want to treat to transformation. Most people would tell you 1 session, but a lot of studies actually shows that you may need 2 sessions to really get you the results that you want. It only treats pinchable subcutaneous fat, any fat that will fit and be suctioned into the applicators for the cryolipolysis of Coolsculpting to treat. So submental, arms, brow fat, abdomen, flanks, and thighs. It is safe because when the fat gets sort of go through your body and gets absorbed, there's no increase in triglycerides or cholesterol levels. And usually results are seen in 3 months. Now, possible side effects, as you can see, that little redness, bruising, swelling. Some people have a little bit tingling and numbness that may stay there for a few weeks, and some people do have late onset pain. The one thing with Coolsculpting that we have to tell you is this thing called Paradoxical Adipose Hyperplasia, which is that picture to your right, where there is a sort of localized fat deposit. Now this does not go away. Usually you have to get rid of this with surgery. Now it is becoming a little bit not as common with the new applicators. However, you do have to make sure that you understand that this can happen. So contraindications that anyone who's allergic or sensitive to cold, anyone with hernia or diastasis recti. Now, diastasis recti, I'll tell you that we actually have a device later on that we'll talk about that actually treats this, and of course, any pregnancy. So our patient here with Coolsculpting submental, it does work. Now, this patient has in the submental area too here, but you have to be very careful because when you do freeze the fat and you do get rid of the fat, sometimes people have too much laxicity. So if the skin is too lax, then you have excessive skin. So in these cases, you have to make sure that patients have realistic expectation. Sometimes with the excessive skin, you have to do surgery to remove that. Or if you have just very minimal excessive skin, we follow Coolsculpting with a device to help tighten the skin. Now, these are very common results from Coolsculpting to help with that subcutaneous fat. Remember, if you can have that fat and get suction into an applicator, it will work. Again, Coolsculpting does work in all skin types. Now, patients can also want to have decrease of fat. Maybe they don't see as much results. However, if they can fit into a dress size smaller or a pant size smaller, I think most people are happy with that. So realistic expectation, what are your goals? That's what Coolsculpting can do for you. Now, again, raw fat is very, very a much requested procedure in our office with our patients, because women, we hate that raw fat. So we want to look nicer in our clothes, in our t-shirts, and in our dresses. Now, these are the arm fats that you can remove with the Coolsculpting. However, the same thing with the chin fat. You have to be very careful that you don't have the excessive skin. So if you have the excessive laxity skin after you remove the fat, you do have to then follow up with the skin tightening devices, or you may just not be a candidate because removing the fat may leave you with too much skin laxity. So we will go over with you the risks and benefits during your consult. Now, TrueSculpt ID. This is fat reduction, skin tightening, and has FDA clearance for cellular reduction. This is a radio frequency device. It's monopolar versus some of the other radio frequency devices, where this then goes deeper into the skin to really melt the fat and melt it in a way where it's more permanent. This has a 24% fat reduction with one treatment. Now, Coolsculpting has 25%. So again, you may need 1 or 2 treatments. The reason I like this is that you don't need to have fat to be suctioned in that. So this is more customizable. So what if you have fat that really cannot be suctioned into the Coolsculpting machine? So you have more smaller deposits of fats. So in the submental, the abdomen, flanks, thighs, arms, and broad fat. So it can treat all body and skin types. You can treat over skin laxicity. There's no BMI restriction. And the submental fat actually has a handheld fat reduction device. So this one is a fast 15-minute treatment protocols. There's no downtime whatsoever. There's no side effects, just maybe a little bit transient redness, and I don't have to restrict any of your activities. I really like that because I'm the type of person that like things that are not that long and no downtime. So when I had this TrueSculpt ID done, I just went right back to work. I had no problems afterwards, no tingling, no numbness. This is a device that helps people, especially if you don't have enough fat to suction into the applicator. This is how it works. You see the monopolar radio frequency goes deep into the fat, because you hear a lot about other radio frequency devices that we have, Secret, Genius, and all that stuff. That is more superficial. That does more skin tightening. Because of the monopolar radio frequency, it actually goes down deep. This device protects your skin, but your fat temperature is higher. So that's how it selectively melts the fat and not have any problems with the skin, and can treat all skin types. And again, 12 weeks after, you have an average of 24% fat reduction with one treatment. These are some of the results that you can see with the TrueSculpt ID. Later on, I'll show you some of my results. So these are very reproducible. And again, you just have to be a good, ideal patient, or a patient that has realistic expectations. Again, this one, as you can see, look at the fat melting, but I also would say she also has some skin tightening along with this too. This is after one treatment. Again, the arms, like with Coolsculpting, you can take away the fat and melt the fat. However, you can also tighten the skin with this device. Because of the radio frequency, it does have a heat around that, and that helps with tightening of the skin. You can also treat the inner thighs and the outer thighs, because remember, the outer thighs is hard to treat with an applicator. So by doing this, you can actually lay the TrueSculpt ID applicator over top of it to help melt your fat and tighten your skin. Another TrueSculpt ID patient, I would say if I had that type of results, I can definitely fit better into my dresses, my pants. Same thing here. You can see that it also has a little bit of skin tightening. Okay. So the next thing we want to talk about, so we melt the fat, we tighten the skin, and you can use other devices besides TrueSculpt ID. Let's talk about muscle toning or sculpting. There's 2 devices out there. that I know of. There's, I think, some other ones out in the market too. But I want to talk about M-Sculpt and TrueSculpt Flex. One is electromagnetic stimulation and one is multi-directional direct muscle stimulation. So the M-Sculpt comes with these paddles. So it gives you indirect feel of energy in the general area. The TrueSculpt Flex actually has around 18 of those small little, we call it positive and negatives, where you can actually put it right over muscle to generate the energy. And again, both of them, besides muscle toning and increasing your muscle mass, it also helps with visceral fat reduction. So think about it. You do the Coolsculpting, the TrueSculpt ID to melt the fat, and then you follow up with either M-Sculpt or TrueSculpt Flex to really also help with visceral fat reduction and increase muscle tone. Let's see this one patient, how they respond to the M-Sculpt.
I'm at Southside Dermatology today, getting the M-Sculpt treatment done. It's the first of its kind where it actually builds muscle and burns fat. I'm actually going to go with the 4-treatment protocol. I'm super excited. I've had it done before, but you have to get it done within a 2-week period. I work out constantly, and I cannot get that, I don't know, carb perfected look that I had when I was 21, 22. So let's see at 40 if the M-Sculpt can make it happen. Thank you, Dr. Pentel, and your unbelievable team. I'm super excited to see the end result.
So the M-Sculpt, because of the paddles, you can treat your arms, your abdomen, your thigh areas, and some people do the calf muscles with this too. And a lot of my women like this for the buttocks. However, I can tell you this one patient that has this right here in the M-Sculpt with her buttocks, she tried the TrueSculpt Flex, and she felt it was more powerful with the Flex. So both of them do well, but we think that the Flex may give you a little bit more, more stimulation. So this is the M-Sculpt trait patient. Remember, M-Sculpt is more to tone your muscle. It does have a little bit fat reduction, but it's not the procedure that you go to just for the fat reduction. Now let's talk about TrueSculpt Flex, the multi-directional muscle stimulation. As you can see, this is one treatment. So you can use this device and put it all different muscle groups that you want, lower back, your abdomen, your thighs, your arms, your buttocks. So what does people say? Okay, it's the TENS. The TENS unit is also electrical nerve stimulation, but one of that, it only, I guess, goes to 1 milliamp. It stimulates and gives you the energy of 1 milliamp versus the TrueSculpt that gives you 30 milliamps. So stimulation of muscle group actually gives you 54,000 contractions or quote crunches per session. So it's multi-directional, so stretch, tone, and sculpt, and it can be used to strengthen muscle or increase muscle mass. So let's take a look at this. When you exercise, the brain triggers your motor neurons to stimulate your muscle, okay? Your exercise, you're getting 1 milliamp to that. Now, the TrueSculpt Flex, think of that machine as also the brain, okay? And so that brain is stimulating your motor neurons, but it's giving you 30 milliamps of electrical signal. That's a lot to your muscle. So you get more of a comprehensive workout with the TrueSculpt Flex than actually doing it at home. But like I say, I love diet exercise. I encourage diet exercise, but in some people who can't, who are not able to do this, this also will give you a great workout. So let's look at the treatment modes. This is a very, very flexible device. Why? Because with one machine, we can go and help you through a, I guess, a workout where we can do a prep mode where you're stretching the muscle. You're building that muscle tolerance to muscle contractions. So meaning you're warming up the muscle. Then you can do the tone mode where it contracts the muscle, holds it, and then relaxes it to increase your strength and endurance. How about for those people who are already fit, who already exercise? Guess what? We can do the Sculpt mode. So they're getting this fast, deep, sequential contractions, that 54,000 crunches, that 54,000 stimulation, where it builds muscle mass and increase the basic metabolic rate. And that's why we also think that's why this also causes fat loss too. So let's look at the video about the mode. See, it creates a twisting motion to warm up and stretch the muscle. See the positive and negative mode. Now you're doing the tone mode, okay? The tone mode is the second mode where you are contracting your muscle, then you're holding it, and then contract and relaxes the muscle. So increase strength and endurance. So when people go through this mode, you can start with prep and then go to tone, or you can stay in prep, or you can go to tone, and then you can go ahead and do this other one, tone and sculpt mode. This sculpt mode is really going to help increase your muscle mass. Look at the energy. It's doing different workout, okay? Deep, fast contractions to build muscle mass. So when we put you in one session, we can do tone mode and sculpt mode. We can do prep mode and tone mode. So it's really customizable, exactly what you're looking at. And it has 100%. So honestly, I was talking to my rep and he says, even the most fit athlete was only able to get up to like 60-something%. So you can never really maximize out on your workout with this. So let's take a look at our patient and, oh, I'm sorry. Hang on. There we go. Let's go back here. Let's see her workout.
Okay, so we are right now doing what we call a true sculpt flex. What this is doing is directly stimulating those muscles. Look at those muscles contract. I don't know if you guys can see that, but okay. So this is customizable because we are putting this directly over her muscle. Did you see that muscle contract? And what this is doing, think of this as the brain. This, your brain, is telling your muscle or stimulating your muscle to do contractions. One of this session is going to give you around 54,000 contractions, which is around, or crunches. So she is laying there, but her muscle is working. So the flute is sounding. So this is, everything is a customizable workout. So what that means is that when it does well, then we are going to increase that percentage, adding, quote, more dumbbells to her workout. So this one, she'll never really maximize, and all this goes through a different workout. You can do this for just prepping, you know, so if someone has sarcopenia, the elder patients where they are having more muscle weakness, we can then build up that muscle, so hopefully help them from falling. You can do it in tone mode. So if you're working out, you kind of just want to tone your muscle, tone your arms, tone your legs. You can do that in tone mode. Or if you're already kind of fit and you really, really want to build up that muscle to sculpt it, then you can use the sculpt mode. So this is very versatile. We can do this, as you can see, all these different muscle groups working. I can do tone mode in one, pose mode in one, sculpt mode in another one. So whatever the patient is looking for is how we can customize this treatment for you. Kristen, how do you feel?
It feels good.
Good? Okay, like sort of like, I know you work out a lot.
Yes, like my muscles are contracting right now. It's different, totally different than a workout.
Okay, well, how is it different?
I mean, I really feel everything engaged at one time.
Okay, okay. And look at, I mean, she works out, you can tell, but she wants to do more tone her muscle and help her, because this woman is getting married and she's gonna look good for her wedding. So check us out at Southside Dermatology. We also have this at our body contouring center at Jacksonville Beach, called 904-400-7772, and let us come and customize your treatment to your needs. Melt, tighten, and tone.
So this is a True Sculpt Flex results. As you can see, now this guy has some really good results. This say 12 weeks after 4 treatments, okay? Now, can we all get the result? Probably not. However, we can get results like this. Can you see, look at her muscle, it's more defined. This is after 4 treatments. And you can do this more to continue building your muscle mass. Now this again, you can see that it builds his muscle, but remember this True Sculpt Flex also helps with visceral fat. So I also see a little bit of fat reduction in him. Now this is how we tell that there actually is muscle mass. This is an ultrasound. See that red line? Well, that red line tells you that the muscle mass is an average of 30% increased muscle mass after a 4 to 6 week session treatment. Now, I love it when things also helps besides cosmetics. So it helps more with a sort of medical need. So as you know, some women after pregnancy has this thing called diastasis recti, where the abdominal muscle is separated. So using the M-Sculpt or TrueSculpt Flex, it actually does increase this muscle mass to help decrease that separation. Now, I was excited when I saw this because this can actually help what we call sarcopenia, which is age-related muscle loss that can increase your risk of falling. I have elderly patients, and I'm always worried, you know, that their muscles so weak that if they had to use like crutches, not crutches, the you know, the whatever to have them stand up, then they it's if you build their arm muscles or their leg muscle, they're able to you know, decrease their risk of falling. So building up the muscle mass in the elderly without, you know, having exercises, sometimes they don't have good core muscle, good neck muscle. If you are rehabilitating, you know, then that would also help too. If you just can't really do a lot of active exercise, by building up your muscle mass, I really think this can help you medically. So the TrueSculpt summary, there is no limitation on where we can put this. You can put it to build up your calf muscle, your lower back, your buttocks, your abdomen, your flanks. You can treat this when you come in. We can hook this all up in any body areas or any muscle groups that you would like. All skin types, all body types. You have different treatment modes that you can customize. There is a 45-minute treatment per session. We recommend 4 to 6 sessions, a minimum of 4 sessions. So you do 2 the first week, 2 the second week, separated by around 48 hours. It's comfortable, there's no treatment downtime. You may have this thing called a little bit muscle soreness for maybe 30 minutes or an hour, but that goes away. You can definitely increase your muscle mass by average of 30%. And besides increasing your muscle mass to look good, you can also treat your diastasis recti and sarcopenia, which is age-related loss of muscle. Now, this is where I think that combination treatment really makes sense. So we know that all these treatments work. Coolsculpting, TrueSculpt ID, Flex, and M-Sculpt. And there is another procedure called Ultimate Contour, which is ultrasound radio frequency. If these work by itself, what would happen if we combine them? So we can achieve that total body transformation to melt, tighten, and tone. So this is a combination treatment called True Body, where we do the TrueSculpt ID and TrueSculpt Flex. For your first session, we do the TrueSculpt ID followed by the TrueSculpt Flex, and then you go ahead and continue with the total of 4 sessions with the TrueSculpt Flex. So the TrueSculpt ID melts your fat, it tightens your skin with the heat. Then you follow with the TrueSculpt Flex, where again, it helps melt the fat because maybe now you can get a little bit of visceral fat, and it builds a muscle mass. Now, after you do all stuff, you are gonna see results, or you feel like you should see results if you also make sure that you still have good diet and exercise. However, you can maintain these results, okay? What if you do this every other month? You can maintain the results you have. However, if you do it every month, you can continue to build on that muscle mass. You continue to build muscle by doing this every month. And we have programs that are set up with both. So by doing a combination treatments, of course, we give you multiple treatment discount, and the maintenance of treatments, you also will get special pricing on that too. So let's take a look to see what our patients are doing with the True Body.
Ted, tell me what it felt like to do the TrueSculpt ID.
It was fine. It was just a little heat.
So this is to melt fat.
That's it, but nothing intolerable.
Like, can most males tolerate this?
Yes.
Good.
Yes.
Good. Because it's heat, you know, it feels warm, right?
It's warm.
Okay, all right. So would you recommend it to other people?
Absolutely.
Okay, especially with the 24% permanent fat reduction, right?
Oh, absolutely.
One-time treatment, 15 easy minutes. Was that the easiest 15 minutes that you did?
Yes, it was easy. For sure.
For fat melting?
For fat melting, for definitely sure.
Great.
Easy.
So we are now again with Ted. Ted, as you remember, just got the TrueSculpt ID to melt his fat. That session gave him a 24% average fat reduction. Now, to further increase his results and benefit, we are doing the True Sculpt Flex, which is that direct electrical stimulation, okay? And Ted, how are you doing?
Great.
Okay, so tell us about, like, what does it feel like?
Just feels like constant vibration.
Okay.
That's what it feels like to me, just constant vibrating.
Okay. And do you exercise frequently or not really?
Not really, not like I'm supposed to.
So you're saying you're cheating?
I am cheating.
Okay, good.
I'm okay with cheating.
Watch out on the beach coming
yeah.
summer 2021. Ted's coming.
That's
Yeah.
right.
So when we are doing this, right, so he needs then 4 sessions of this, 4 to 6 treatment sessions is what we recommend. And they're done every 48 hours apart. So twice a week. So for 2 weeks, you'll get your 4 session. If you want to also, you can continue to do more. So you can do this 4 session. You continue doing, get this every month, like a gym membership, I guess, and continue to start and continue to build his muscle and melt his fat. So I think this is going to look great on you. Okay, so doing the True Body, including the True Sculpt ID and the True Flex will give you that whole body transformation. It's going to give you the melt, the tighten, and the tone. That's what everybody wants. Right, Ted?
That's right.
Okay, so call us at Southside Dermatology and Laser Cosmetic Center. Come in and let's transform your body.
So yeah, so this was done in the same day. So he went from the True Sculpt ID to the True Sculpt Flex treatment. Now this is the combination of the True Sculpt ID and True Sculpt. As you can see, the fat reduction, but look at his muscle, or look at the muscle. There's a little bit more definition. Okay, so this is me. I did this, I think, starting in October, and then 4 months after, we took another picture. My daughter's getting married, and I do highly recommend the diet, good exercise, but I wanted something a little bit faster to see results. And I'll be honest with you, I just do not like to exercise, and I have a really, really bad diet. So when I started seeing results, it actually motivated me. So I did lose weight between here and there. So I'm not gonna lie to you. So definitely you really need to continue, doing your diet and exercise. But I like this because it kind of like sort of motivated me, started the process faster. So when I started seeing results, I started, I guess, continue on a good diet. I'll be honest with you, I still don't exercise. I just can't, I don't know, exercise and me, we just don't get along, I guess. But so this is also a great jumpstart to my journey to looking good for my daughter's wedding. This is also another true patient of ours that did the True Sculpt ID and M-Sculpt. Now I did M-Sculpt and she did too, because we did not have the True Sculpt Flex. But I had patients and a staff member who did the M-Sculpt and the Flex, and they felt the Flex was stronger. They felt the muscle more, the contraction more. They felt like it was, I guess, work better. So we don't know. We don't have any studies to compare the M-Sculpt and the Flex, but I can tell you that if you ask my staff, they prefer the Flex. So you also, of course, we talk about melt fat and you talk about toning the muscle. We also have to do skin tightening. Now you hear a lot of radio frequency out there, and it kind of can be confusing because you do the monopolar radio frequency, and that gives you the bulk heating that goes deep. The bipolar means that between 2 needles, it's more superficial. So that helps more with the skin tightening too. So these are the skin tightening devices that we do have. So if you need that after you melt your fat and tone your muscle, we can also add these skin tightening devices to your treatment plan. See that right there? This is bipolar, so it goes between the needles. So I'm so glad that you were able to join us. And for tonight, for all those who were able to join us, we are offering 25% off Coolsculpting, M-Sculpt, True Sculpt ID, True Sculpt Flex, and Ultimate Contour. We have 2 locations. Most of our devices are actually at our beach location, but we do have the Coolsculpting and a few other devices at our Sunbeam location. Please call. At the end of this event, you will be contacted as if you would like to have more information. It's not an obligation. You just wanted more information. If you can respond yes, my staff member will get back to you and maybe have you can come in and have a free consult to see if any of these devices can meet your needs. So we are here. Please, we would love to see you. We have a current location, Sunbeam Road and Jacksonville Drive. And I'm so excited to be able to tell you that we are opening a own office in our own building on 1807 3rd Street North in Jacksonville Beach. It's a little bit south of Fletcher Middle School on 3rd Street. So we hope to see you at any of this location. Please give us a call. So thank you so much for attending. Next, we're going to have the live questions and answers.